Welcome, and thank you for taking a few minutes to learn about physician burnout, diagnosis, treatment, and care. My name's Doug Gray. I want to focus on you. You're not alone. Imagine a comforting hand on your shoulder. And for many generations, you probably know, a stigma has existed that says physicians can endure medical school, endure residency, therefore they can endure anything. Well, some critics in healthcare today say that that social contract no longer exists. A lot of discussions about healthcare reform and continued changes in care, but burnout is higher among physicians than any other professionals. And since the days of Hippocrates, physicians have been taught to ask this question. A lot of nurses and physicians will tell me they're depressed, they're overwhelmed, they're feeling unable to provide care for others. They're unable to pay their lingering residency debts of 150K or to save 250K for their kids to attend a great college. So that notion of healing thyself, as if healing is an easy process, begs the next question, which is who takes care of the caregivers? And that's the reason for this little webinar. You might be concerned about yourself or a loved one or your practice. And the point is, without discrediting the Incredibles in the Disney movie, the point is you might wear a white coat or a red cloak, but you're not a superhero. The costs are tragic. 2015 article in Medscape called Two Sides of the Physician Coin, Burnout and Well-Being, states 40% of physicians admit regular self-medication, and the drugs of choice range from alcohol to amphetamines. And 15% of physicians have admitted to feelings of suicidal ideation in the last 24 months. That's tragic. Virtually 100% of physicians have experienced burnout at some point in their careers. So, what are you going to do? You're trained to be an expert at these 4 steps, and my objective in this little webinar is to help you self-diagnose and assess your need for treatment and care. Some have told me there's no solution to the burnout problem. We can diagnose, we can prescribe, and we can provide care. I disagree. I'm going to show you how. Well, let's start with problem definition. The psychiatric definition of physician burnout, published by the AMA, is somewhere in this word cloud embedded. I don't mean to scare you, but note that each of these words is a harsh description of the depressive disorder that can paralyze you phrase or your colleagues. And one source estimates that at least 60% of the physicians in your practice group are experiencing burnout right now. So look to the left, look to the right. Think about 60% of the people in your last meeting or round session. There are lots of published papers in JAMA and the Mayo Clinic's proceedings. One that I'd recommend is called Physician Burnout, A Potential Threat to Healthcare Reform, 2011. All these references are at the end. And Physician Satisfaction and Burnout at Different Career Stages. You'll see some slides to those points in just a moment. Burnout will be defined in a second, but think of it as the emotional exhaustion, the depersonalization, and the lack of self-efficacy at work. One physician said, I'm not sure that I just have the energy to get up and do what I know I'm supposed to do. Think of it as a continuum. Continuum are familiar territory for any physician, and resiliency can be defined as the capacity to adapt successfully in the presence of risk and adversity. So take a moment. Write down where you think you are on a scale of 1 is low, 10 is high on these 2 measures. Burnout and resiliency are directly related, thought to be inverted, like a coin with 2 sides, which is why the coin's there. So a self-diagnostic question would be, how do you know if you're avoiding burnout behaviors individually? An organizational diagnostic question is to ask your team if they have noticed you being less compassionate, less hopeful, less caring lately. Or if you're really daring, ask your team if they've noticed you being more abrupt, judgmental, impatient. This is one of the things that I do, is assess the degree of burnout or resiliency in a group or in an individual. A second way to self-diagnose is to take a validated assessment. Here's one called the MBI, the Maslach Burnout Inventory. 3 submeasures or variables of burnout. And when gathering data for any diagnosis, we typically use several assessments for resilience, for engagement, for patient satisfaction, so we can diagnose the key variables. whatever's going on in your world. Once we have that data, we can determine the behavior changes to focus on. Yes, dogs of any age can learn new behavior. Physicians, nurses, administrators, and practice group leaders are capable of practicing new behaviors. Healthcare is a team event. I don't mean that in a light way. Nobody succeeds by themselves. We all need coaching and consulting at times. That's the reason of diagnosis. So 2 key questions. 1, how do you know if you are suffering from physician burnout? And 2nd, treatment and care. What are my options for treatment and care? You can fill in the blanks, and the next few slides will help you better understand your personal situation. Let's start with the popular comic and tragic reality TV shows like Scrubs. These things can be more accurate than some physicians like to admit. Last month I had dinner with a physician in LA who said, "I envy those actors. They get to say what we cannot say." And he still watches the reruns. So here's an elegant slide that depicts physician burnout and gender differences at 3 different stages in careers. Where are you? Early career is defined as the first 10 years after residency, and middle career is years 11 to 20, and late career is years 21 plus. The sample size was over 7,200 physicians, reported by Dryby, Varkey, Boone, Satie, and others in 2013. Again, the references at the end of this slide deck. The tragic big picture is that roughly 50% of all physicians complain of burnout, and that 50% is higher than any other profession in the U.S. Go to action-learning.com, call this number at any time, and we can help. Thanks.